Hi.
Hi.
How are you?
I'm good.
My name is Stella.
I'm
Going
Stacey.
to be your therapist today.
Thank you so much.
Okay. What's hurting?
My neck. Hey, like it hurts so bad. I think because I'm always like on my desk all the time. So yeah, it kind of like I'm strained a lot.
A lot of stiffness, yeah?
Yes.
When does the pain hurt? Mostly when you wake up in the morning or at the end of a long day seated?
Let's say like mostly in the evenings and in the mornings when I wake up.
All right.
Yeah.
So let me just check your neck for you.
No
then I'll be
problem.
able to help her.
No problem.
Just come on the bed and then change into this gown, okay?
Okay.
Yeah. That basically a muscle is supposed to have elasticity that allows us to move the neck. For example, this is called the scalene muscle. You see how tight it is when I do this. This means it does not allow the head to move as comfortably as it should when she's turning to the right and to the left. And even if you look, like this shoulder is getting to the end, and this other one there's a bit of like she actually has a stiff neck on this side. So we'll be sorting that out for her just now. The assessment I just did is very important to ensure that you actually confirm, especially from what the patient told you in the subjective examination. Now, me checking is actually called an objective examination. It's part of our assessment procedures so that we can be able to pick exactly what's causing us our problem before we start our treatment.